Good morning, everybody. Good morning, everybody, and welcome to AIM Impact on Your Health. AIM Impact on Your Health for every day. Our goal is to have you learn at least one thing to help you live better and longer. AIM Impact on Your Health is heard each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney, and I'm with you each and every Monday, Wednesday, and Friday from 8 to 9. AIM Impact on Your Health, where each day you'll find current medical news, knowledgeable guests, fascinating health topics, and of course, where we do encourage you to call in to join in. Today, well, it's a Monday morning version of the show. Once a month, we get with our good friend Shannon Goosen. We call it Microcurrent Mondays. It's a big movement, a paradigm shift actually occurring across this country in the field of medicine and health, how to control your own health with the help of electronics. And we have really ascended to a level of health that, well, really wasn't even predictable 4 or 5 years ago. Today we're going to be talking about what to look for in a unit of microcurrent. How is it presented? What features, what attributes does a device have to have? Hey, how about the practitioner? What kind of attributes do they require? Well, we're going to get it straight from the gut from our good friend Shannon Goosen, who will be coming aboard today to talk about microcurrent. She's been involved with this for over a decade now, even beyond, and is as well versed on the subject as possibly anyone could be. She's our go-to person when it comes to microcurrent. So today, Shannon will be with us for the entire hour. In the course of the time we spend with her, if you want to call in to ask a question or to make a comment, the number to do that, of course, as you should know by now, is to dial us up at 412-825-6262. That's 412-825-6262. I will give that number additionally throughout the hour. The rest of the month of December is clipping along at a pretty good rate. Wednesday's show, oh goodness, you don't want to miss it. Dr. Ed Condrat called in such it is about a little over a week ago with the new research on the effectiveness of these intraocular, or I don't know, they're injections given by ophthalmologists to people who suffer from wet macular degeneration. And of course, wet, as distinguished from dry mac, is where there's bleeding in the back of the eye, and through the use of a substance called avastin, which is an anti-VEGF compound that prevents the formation of blood vessels. This has been a treatment that's been long in play, an expensive treatment, well compensated are the eye doctors who do them, but we find out there is absolutely a problem with those injections. If you're at a scheduled one, if you have one that is scheduled, you may want to wait and listen to the show by Dr. Condrat on Wednesday. He calls the show the Watergate of eye care. And I think what he's alluding to is that there may just be a little bit of a conspiracy to sweep this research under the rug. These are harmful injections in a high percentage of cases, and we're going to present the entire case of injections for macular degeneration, wet type. If you know somebody who's been getting them, and they don't, certainly not being told, I'm going to guess by their ophthalmologist, you'd like to think so, but I know the way things work. Don't need to pay attention. Listen to our ophthalmologist, your go-to ophthalmologist you've been hearing from for a long time on this show, and Pittsburgh boy himself, Dr. Ed Condrat, is going to be our guest on Wednesday, the Watergate of eye care. The rest of the month's going to clip along at a pretty good rate. Now, don't forget that Christmas Eve is the 24th this year. Perfect. It's on a Wednesday. It'll be our time to do our annual Christmas show entitled An Altercation with an Elf. I know if you've been listening to this show for any length of time, you have heard this annual show. I know I find you out there, and the first thing you say when you meet me could be in the middle of August is, hey, I like that show about the altercation with an elf. It's coming back to you on the 24th. In the news, mumps are in the news. I didn't count on it, I didn't figure it, but of course Sidney Crosby is out of action. He's down with the mumps. There's going to be a lot of hubbub about this issue of vaccines. It's going to start coming up. It should come up. Sydney, if I read correctly, as a child got the NMR vaccine, as most children do, that's that one that comes in at 18 months and is a real ripper in terms of the devastation that it causes. For the first M, the measles component, of course, the MMR stands for measles, mumps, and rubella. And the mumps component looks as though a year ago, Sidney Crosby had another vaccine. So that makes two in preparation for the Winter Olympics. So here's a guy who has vaccinated himself twice and now is out of action because he is suffering, and it has been proven through lab tests, with the mumps. This is going to cause a whole bunch of controversy out there. There's a plague, quite a few, I guess, hockey players spreading around the NHL. You know, with a disease like this, it's gonna move in the general population, and we'll be hearing an awful lot about these vaccines, how beneficial they are, how harmful they are, and the like. A lot more coming up with mumps here in the very near future. That MMR the vaccine, which at 18 months, I'd have to tell you that is sitting in my seat as a practitioner dealing with children on the autistic spectrum, and asking parents how this disease manifested itself. Well, it's not a disease, it's a disorder. I want to stand corrected on that. But the recounts of how this unfolded was normally that the description of a newborn, completely normal, functioning in every way, in a normal way, reaching milestones, acquiring speech, acquiring movement. One day, things change. It just happens so abruptly. And when I question the parents about what the time frame is that the change occurs, almost invariably it focuses in on about the 18-month age group. I believe it's no accident that the MMR vaccine at around the 18-month mark is the hallmark to why we have the problem with MMR vaccines. And the M, the measles component, is the first time we get an RNA live vaccine. That's the first time. And I believe the combination of live and RNA instead of DNA vaccines make this the devastating potential that it really has become, and really should be questioned by parents before they willy-nilly go off and subject their children to it. At least on the mumps component, the second M, measles, mumps, and rubella, looks as though maybe it's not holding up too well with being able to provide some immunized children so that they can't get the disease. And here, a year ago, Sidney Crosby gets another vaccine, another mumps vaccine. Big questions to ask medicine with up and coming weeks. Okay, let's do this, folks. Take a short break. In the interim, we're going to get with our good friend, Ms. Shannon Goosen. She is our go-to when it comes to all things regarding microcurrent. Let's find out what she thinks about the units that are available, the practitioners who utilize those units, what should be on your checklist before becoming involved with microcurrent. I believe it's a very appropriate series of questions to ask, and we got the right person to answer them. Be right back in a moment with Shannon. Good morning, ladies and gentlemen. Welcome back once again to AM Impact on Your Health. Heard here in KHB 620 each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney with you today, the Monday morning version of the show. And as you've come to expect, at least one Monday of the month we've set aside. We call it Microcurrent Mondays. The topic is on a new type of therapy available. I believe it is a paradigm shift in medicine. I believe that you're going to be hearing more and more about the benefits and the abilities of this unique treatment called microcurrent therapy with the up and coming months ahead, certainly from this office, but I believe countrywide. This thing is about ready to move into overdrive, and you might as well get it straight from the horse's mouth. In our case, we've got quite an individual who represents microcurrent. She's been involved with it for over a decade at its really his initiation, and has watched it go through many changes. We're going to be asking her about some of those changes today. Her name is Shannon Goosen. She is with us right now. Let's say good morning and welcome back, Shannon.
Good morning, Dennis. Thank you. I'm so glad to be here.
Well, Shannon, you're down in Jacksonville, and this is our third show now, and I will tell you that things are really getting whipped up. A lot of murmuring in the background. Patients of mine and patients who are not mine are talking a lot about microcurrent therapy. I want to ask you some specific questions about these units. We have them being represented by many practitioners up here, and I'm getting concerned that they may not be getting the right information, and I think that you'd be the person to provide that information. But let's sort of back up just a bit. We always have a new group of people, and I got to be aware of them because they're probably saying, what in the heck is microcurrent therapy? So I know you've done it before, and probably will do it many more times again, but could we start out by allowing you, in the best way you know how, to tell our listeners what microcurrent therapy is?
Dennis, I love to give the great example of microcurrent therapy and how it works in the body, and allowing people to understand that microcurrent is actually in our body already. It is what powers the nervous system, that powers your brain, that powers your muscles. And so we're always already using this kind of very, very gentle electrical current that flows through the body. We are electrical beings, and this is how we power ourselves and do everything that we do throughout the day. And the example that I also like to remind people of is that we are surrounded by these different types of currents, and they're used all the time. So we can look at microcurrent therapy as the energy pack of the body. The way that you would see it in your daily life, the way we use electromagnetic therapies, is that you can have a clicker for your car, and you can press a button that says unlock, and you can be in a parking lot with 1,000 cars, and it is only your car that is going to unlock. So we're surrounded by these energies of communication that are not attached by wires, that go through the air. All of us do this all the time with radio waves as we talk to each other on our cell phones. And right now I'm in Jacksonville, Florida. I am on a cell phone, and you're able to hear me, and everybody is able to hear me. And that is because there are frequencies that are running through the air. So there are two pieces to this. We have this electrical energy that our body already uses and knows what to do with, and it powers us. And then we have specific frequencies. And those frequencies allow me to talk to you, and for all of your listeners to be able to turn on their radio, dial in their radio station, and be able to hear us now. So these subtle energies are around us everywhere, and we use them every single day. It's just, Dennis, that we take it for granted. That seems normal. What doesn't seem normal is that we would be able to take that same concept and be able to apply it to medicine. But electromagnetic medicine was actually state of the art medical care in the late 1800s and early 1900s. It's been around for a very, very long time, and Dennis, it simply went out of vogue when the medical community decided that pharmaceutical drugs and surgeries become the standard of care in the United States and actually in a lot of places. But if you go into other countries and other places and other cultures, using electromagnetic therapies and specifically microcurrent therapies is still state-of-the-art care for people. So microcurrent therapy is taking microcurrent, which is current that runs in millions of an ampere. We deliver these currents through two channels in the method that we are using, and we deliver specific frequencies into the body that resonate. And that resonant effect allows us to, in some cases, instantaneously change what is happening in the body. And there is, in fact, research supporting this. So in a nutshell, Dennis, microcurrent therapy and using specific frequencies.
What a great, I love that thing with the cars and the keys and 1,000 cars and only yours unlocks. Great analogy. I'll never forget it. I'll use it 1,000 times myself if you give me the permission.
Absolutely. And Dennis, if you think about it, the old-fashioned way that we used to unlock our cars was to take a key and you had to put it in a lock and turn it, and it had to be the right key in the right lock, and nothing could be rusted and everything had to be working properly. That's the old-fashioned way. What's curious, Dennis, is that is our current belief of medical care. We are still in this cause and effect. If I do A to B, I'll get C. But you and I know that's not true. If you do A to any particular person, you have no idea what the outcome is going to be because people are individuals. So here we are using that old-fashioned lock and key method to treat people with medicine. And we know from the pharmaceutical industry and what has happened with all the side effects and complications from taking medication that that just isn't working. And while there are certain times where medications are perfect and life-saving, and surgery is the perfect solution and life-saving, when we are dealing with promoting optimal health and dealing with chronic illness, it just doesn't work. It has failed people.
Let me ask you this question, Shannon. 30 or 40 years now, we have had in the medical realm a electrical device called, I don't know, TENS units, electrical stimulation. It really swept onto the scene, I'm going to say in the late 70s and early 80s. They became quite popular. Are these devices microcurrent? Are they not microcurrent? Are they the same? Are they different? Because I believe folks out there think, oh, I know about that. That's that TENS unit that I had done like in 1989. And I'm not so sure that that is anywhere near the same as what we're talking about today. Would you take a moment and distinguish the two?
I would love to. TENS is not microcurrent. TENS delivers 10,000ths of the amperage that comes through, and that current is sensory. That is the current that you go into physical therapy, and they will put TENS, they'll put galvanic stimulation, they'll put these other stimulating type currents on the body, and the intention is to make muscles jump and move and contract, or send very powerful signals into the nervous system that are actually much stronger than the nervous system is already generating. Those currents overwhelm any of the subtle information that it's going through, and on this particular type of nerves that they travel, they get to the spinal cord faster, and they block pain. So what I would say is that they certainly have a place. When you have something acute, and you immediately need to get pain under control, you can help block those signals by putting on a TENS device. When you have had a severe nerve injury, or you've gone through surgery and you have a limb that's been immobilized and you've got muscle atrophy, we want to use galvanic type stimulation to contract, relax the muscle. You're basically doing a passive exercise when someone can't move, so they have a place. But the 10's really long-term, Dennis, when we use it, it actually depletes energy in the body. It's counterproductive for any kind of chronic condition or anybody trying to heal from something. So I really tell people to avoid 10s unless we have a specific reason that we need to be blocking pain and we need to try to do it quickly. So they're very, very different. And I think that really the confusion happens, Dennis, is because all physicians are, for the most part, educated in 10s. So as soon as you say any kind of electrical stimulation, everybody is immediately thinking that because it all gets categorized that way. And unfortunately, even when we do physical medicine coding, it doesn't matter what kind of stimulation you're using, it's all coded under ECM. And that is just basically an error in the way we do our coding, but lumps all of it together. There's very different types of electrical stimulation. They do different things. And the thing about microcurrent therapies is, for the most part, you can't feel them, or the ones that you can feel, they feel good. Anybody that has 10s will tell you that originally it was pretty irritating, but it's intended to be a counter irritant to block pain. So they're very, very different. And when you go into your doctor and say, hey, I want to try this new therapy, it's microcurrent and helps heal, they may go, oh, yeah, that's 10s. I know what that is. We can order you a 10s machine. Don't do it. It's not the same. It's very different. And it does something completely different. And if you've got a problem, chronic, or you're trying to heal from something, it's actually going to block the energy production that your body needs to help you heal.
I'm glad I asked that question, because I think that that confusion out there is rampant, and the listeners can really benefit from being able to distinguish one from the other. Hopefully, before the show's over with, we'll be able to help them come to be able to ask the proper questions to sift through this. One thing I probably would like to mention, see if you agree, that when it comes to the 10s units, I think they're wonderful devices in their day. Even today, to get relief from pain and block by literally jumbling up the sensory inputs into the brain and never allowing the pain message to get there because of this powerful current that blocks it, it has helped so many people in an acute stage. But I think the point that I would like you to expound upon is that there's no healing. When the 10s unit is done, nothing has happened to cause you to heal, to improve, to get and nurture tissue back to health. It just interrupted the flow of pain for a while. Do I have that concept right?
Yes, Dennis, that is correct. And that is what makes it counterproductive. Although in certain circumstances, even I would tell someone, out of necessity, if that's what they had and we had something acute, go ahead and use that, because I think probably if I had to choose between a 10s unit and some really dangerous drugs, I would opt for the 10s unit in certain circumstances. And there's even something called a spinal cord stimulator or a nerve stimulator, and sometimes those get implanted into the spine in different places, and again, that just blocks the signals to the brain to make pain go away. And sometimes, people have had really serious nerve damage where you just can't fix the nerve, and it doesn't fire correctly, and it causes chronic pain. So these can be very, very helpful. Unfortunately, Dennis, there's probably a lot of people that know about nerve stimulators, because that has just become the thing to do when a practitioner or a doctor doesn't know how to treat someone's pain. They'll just say, well, we can implant a stimulator and we can block the signals, never actually getting to the cause of the pain. And in some circumstances, Dennis, there are absolute things that we can do to deal with the pathology and to correct the problem and treat the pain. From a fundamental standpoint that you're talking about, because we're going to go in and find the owie, and we have a way to fix it. And that's really what we want to do. Unfortunately, our current state of medicine, because they went the path of surgery and pharmaceuticals, there's a very small number of practitioners that actually know how to get to the root cause of what is causing people's chronic pain and problems, and knowing how to address it and ameliorate the pain.
A great answer to a question I'm sure that that our listeners appreciate, to be able to distinguish, make them sophisticated users of this miraculous therapy now becoming available to them. And you've been so involved for such a long time with this, and you're a relatively young person, yet you were there when the changeover occurred. How has this device evolved over the years? When did the evolution occur? Because when you go from thousands of an ampere, as is found in electrical stim, to millions of an ampere that is now found in microcurrent, that's a light speed change. When did that change occur?
Well, Dennis, those types of currents, the microcurrent, actually was in vogue for a while in probably the 70s. And there's different types of microcurrent equipment that has been around. And curiously, the reason that it kind of fell out of favor is there were practitioners that didn't really know how to use it in its best and highest good for healing, and patients couldn't feel it. And so there was this kind of assumption, if I can't feel it, it can't possibly be doing it. And so, especially for physical therapists, they didn't have a good answer because, they're about exercise and doing things and sometimes inflicting pain on you to get things done. And here they were using this therapy and people couldn't feel it. And so they wanted to feel like something was getting done and being done to them, because that was the kind of belief that if you're going in for physical therapy. So it fell out of vogue. And then it was actually Carolyn McMakin back in, really in the late 1990s, she had got a precision microcurrent unit. Well, actually, it was, we call it the blue box. And it was a 2-channel analog microcurrent machine. And she was going to use this to do aesthetic work, because everybody knew that we knew anything about microcurrent from all of the research, that when you put any kind of microcurrent into the body, you actually increase protein synthesis. You increase collagen production. You decrease inflammation. You increase blood flow. So all of this in a laboratory setting and animal studies had been shown over and over again. So for anybody that was interested in anti-aging, microcurrent has always been the way of aesthetics, and it's been around for a very long time for that. So while Carolyn was using her blue box, her analog machine, she discovered from playing around with some different frequencies that she had that she was actually able to change tissue very quickly and get rid of myofascial trigger points. So she started experimenting with it and getting very, very good results. And then she asked practitioners to start doing what she was doing. They were able to reproduce their results. And I think there is as well over 3, maybe close to 3,500, 4,000 practitioners that have been using these 2-channel microcurrent devices that deliver specific frequencies that seem to do very, very specific things, reliable, because you have all of these practitioners throughout the United States and actually in several other countries that are getting the same results. So it's been since the mid-1990s that we started gathering more data on these frequencies that had been used in the late 1900s and early at the turn of the century. Well, the first one in the 1900s. Mm-hmm. So there's been a lot of clinical experience with using these frequencies, and the most important thing that anyone would have to know if you're looking for a device is, number one, that it has to be microcurrent. You have to know that it delivers microcurrent.
Millions of an ampere.
Millions of an ampere. The second thing you have to have is something that is 2 channels. You need to have a frequency on A and a frequency on B, or a frequency on one channel and a frequency on the second channel, or the 2 channel. And then you have to be able to have those frequencies go up to at least 3 or 4 digits. So you need to be able to change it to a tenth position if you need to. So you need to have at least 3 digits on it. So you can go up to 999. And then, you just have to have a way to deliver it. So they're battery operated, and they can be used with pads like you would traditional electrical therapies. A lot of the different equipment also come with different types of electric gloves, meaning there are different types of gloves that are mesh or graphite that deliver the frequencies into the body. And those are the most important things. You must have something that is a microcurrent delivery system. It needs to be 2 channels, and it needs to have 3 digits, so you can go up to 999. And those are the primary specifications, and all of this equipment is battery operated.
The question that is almost begged by your description is the word programmable. These devices must be uniquely and individually programmable. Am I right about that?
For someone to have a unit that they want to use daily, weekly at home for a variety of reasons, it needs to be programmable, and it needs to be programmed by a licensed practitioner that is trained to do this. There is equipment that we use that is professional equipment as well, that we can actually select the frequencies ourselves. So you either have a unit that is programmed already with a string of frequency combinations, or you have to sit and do it yourself. Dennis, I do both, because the way that I figure out what frequencies I need to be using in some of the complex cases, or when I don't know what is happening for someone, I actually test the frequencies in the body to find out what they respond to. Sometimes people respond to frequencies within seconds and minutes. So, we know that those are the frequencies that they specifically need. There's other frequency combinations that we use, especially for trauma, if you've had any kind of injury, that we've got 15, 20 years of basically experience using this. So there's a lot of clinical effort that has happened where people have used these specific frequencies over and over again, and they seem to work every time for specific conditions. So those we already have programs that we know specifically work for certain conditions very reliably.
Speaking of the people who apply these devices, what could you advise our listeners when it comes to the practitioners? First of all, to purchase a device, I think you're pretty very clear about the attributes of the machine. But what about the person that is using the device, especially in a clinical setting, like an office setting, like you're using right now, and like we are using also? What are the qualities and characteristics of a microcurrent practitioner that our listeners should know about?
Well, number one, they need to be licensed. Make sure that you're working with a licensed practitioner. And for someone to be working in a clinical setting, they need to make sure that providing electrical therapies are within the scope of their license, or that they are a trained practitioner that is working under the license of someone for which that is in the scope of their practice. So not every state has electrical stimulation in the Practice Act, say for licensed massage therapists, and they can work under a chiropractor or a medical doctor, and within that scope, someone can be very, very well trained and be working under someone else's license. So do make sure that you have a practitioner that you're working with that is properly licensed, trained, and it's in the scope of their license, or they are practicing under someone for which is in their scope of license. So that's very, very important. But the frequencies work, they're powerful, and you have to make sure, from my perspective, it has to do with a very strong phrase, but from my perspective, I would want to know that somebody is well trained and knowledgeable about the frequencies and knows how to evaluate someone for any condition in a way that is going to allow them to have very, very good decision-making planning about delivering what kind of therapies and conjunctive therapies and holistic therapies in order to quickly and effectively address whatever that person is claiming as.
You specifically mentioned, I'll ask you to elaborate a little further, that as long as you work with a licensed professional, and you mentioned chiropractors and medical doctors, are these, do you feel strongly about the involvement and as being a necessary part of the use of these devices, that you got to have a doctor, would that be chiropractor or medical doctor, at least involved peripherally?
And in some cases, actually in most cases, you're absolutely gonna want to have that. There are other cases where if you are practicing within your scope and it is your area of expertise, you would not need to have that. So one example would be Florida using microcurrent therapies is within our practice app, and massage therapists are much, much better at treating myofascial pain and muscle issues as opposed to those physicians and a lot of chiropractors, because they barely even know where the muscles are, what they do, and that they can cause pain. Whereas the massage therapist is the expert in problems with muscles because that is their area of expertise. So in that case, a massage therapist using microcurrent therapies to deal with problems, myofascial pain, it's completely appropriate for them to be doing that. Now, if someone comes in with a closed head injury, a broken leg, a torn joint where they've got a severe sprain, you need to have appropriate medical care addressing that first and evaluating that person so we know exactly what's going on, and then be using those frequencies to help heal those conditions under the supervision. So those are two examples of that. So that's why I always bring that practicing within the scope of your practice, your license, and your area of expertise.
I know that we've talked much about, and in fact, we mentioned on the show that in the Jacksonville area, you have an interesting program, and the people who you have managed certainly are aware of something you call second call. You really want to make certain that the physician is in the loop, at least at the beginning of the line, to make sure that all pathologies have been scrutinized, and if there is any need for medical intervention, it is in play, or at least has been waived off by people who work in the realm and our physicians. And then after you've known that kind of intervention's been provided, then it's you that you want to have call second. Why don't you talk about this interplay between medical care, emergent medical care, and then the need to get involved immediately after, especially trauma?
Dennis, this is where we shine. And you and I had this conversation in October, and it was casual conversation. And of course, you were the one that basically coined, in a way that I hadn't thought of it before, second call. I tell my patients, if something bad happens to you medically, I want to be your second call. The first call needs to be to whoever needs to come get you and take you to the hospital or an urgent care or acute center, an ambulance if you need one, whoever that first emergency call needs to go to in order to get someone taken care of immediately. So you've been in a car accident, you're badly injured, you've fallen and you've broken a leg, you've tripped over something, you've passed out and you've hit your head. So something has happened, and you need to make sure that you are medically taken care of first and foremost. And after we know that someone has had the proper emergency care, and this, Dennis, is where medicine shines in the United States. I am not your first call if you've broken a leg and your bone is sticking out, because I can't set that bone and sew you up and save your life if you're bleeding to death. But let me tell you, in the United States, you are going to get good care, and it's going to get taken care of when you make that emergency call. This is where we shine in a crisis. This is where medicine works. This is where surgery works. This is where the emergency rooms work. And this is where we want to take advantage of it, get that taken care of. After that, I need to be the second call, though, because the place that microcurrent therapy shines in a way that nothing else ever has is that if we get these frequency combinations on you for acute injuries quickly, it totally changes the outcome of what happens. So you don't get swelling in the same way. We can stop the bleeding, and you're not going to bruise in the same way. You're going to heal anywhere from 2 to 4 to 6 times faster than you ever could have imagined. You're not going to have basically the same scar tissue and tissue problems in that area where your joints don't work as well as they could have when we've had a joint injury. If we can get these frequencies on you immediately, certainly within the first 12 hours, but ideally between 0, meaning the time that it happened, and 4 hours, we have an incredible likelihood of completely changing the outcome of that injury and healing you at speeds that no one thinks is even possible. And we do this on a regular basis. So it's just normal for me, Dennis, to heal fractures in 2 to 4 weeks if I can get the current on people quickly enough. If I can get current on a torn muscle, we can heal it in weeks rather than months. A sprained ankle, rather than being in a brace for a grade 2, grade 3 sprained ankle, we're going to have you moving around and walking in 2 to 4 weeks, and in days, not even realizing that you hurt yourself. And if you've been in the hospital and you've had surgery, we're going to heal you at lightning speed after that if we can have the current on you immediately. Again, that's the second call. Get yourself taken care of from an emergency standpoint. If you need a bone set, get it set. If you need to get sewed up, get sewed up. If you need a CT scan of your head to make sure you don't have a bleed, get that done. But after all of that is done and someone is stable, we need you on the way to our office. You pick up a unit, run it at home all the time, or you get in our waiting room, and we're going to be running current on you immediately. And that's worked very, very well in Jacksonville. And there's times, Dennis, where we can have up to 5 to 6 people in our waiting room because they've had some kind of trauma or something happen.
Now that the concept is really clear, I think our listeners can appreciate that for acute trauma, the formula of call number 1 is to the medical professionals, and call number 2 are to the microcurrent professionals. How about in the area of chronic pain? And then thirdly, organic disorders. How well does microcurrent stack up? Because I'm getting the impression it really works well in acute trauma. What about chronic pain and chronic disease where you don't even need an ER, okay? And organic disease where one would even consider going to an ER because they've been diagnosed with serious diseases that have lasted for, sometimes months to years.
Dennis, this is how I got into it. This is where, I am a very, very well-trained, very, very good pain practitioner treating chronic myofascial pain, acute myofascial pain, dealing with chronic pain. This is the world that I went into and where I started. I started at the top with some of the most brilliant practitioners, amazing training, and my head did a double take and a spin when I realized that I could take a chronic problem and just change it in an hour and a half. I just had no idea that something could work so quickly, and it completely changed my belief in the way that I look at chronic pain problems. Number one, there really isn't any chronic pain problems that I'm afraid of. I can't help everyone, but I can help most people, and even in the people where I can't ameliorate the chronic pain because they've got serious nerve damage, excuse me, chances are I'm going to actually make them feel better inside, meaning they will have a sense of wellness that they didn't have before. So we do, just again, amazing things dealing with chronic pain using microcurrent therapy. And we can modulate the nervous system using these therapies. So we can effectively treat nerve pain. We can effectively treat whole body pain, that people call fibromyalgia, which has this downstream, basically just waterfall effect of thing after thing after thing going wrong in the body from being in chronic pain and being chronically inflamed. We know that we can reduce inflammation very, very quickly using specific microcurrent frequencies. We know that we can reduce inflammatory cytokines very, very quickly using specific frequencies and modulating the nervous system. We know that we can reduce trigger point activity in the body. We can get rid of old bone pain. We can get rid of inflammation in knees from cartilage and the joints. We can deal with spine pain. We can deal with discs in the back. When people have disc injuries or annular tears, we've got frequencies for that. So from a physical medicine standpoint and using specific frequencies, we have them for just about every single condition you can think of. And there are people for whom it's in the scope of their practice to be using frequencies for visceral problems, and they've been very effective. And anything that you can think of, we probably have a frequency for that. And I think I've told you, Dennis, that what I say is, oh, we have a frequency for that. And then you test the frequency to see what happens.
And how do you test, by the way? You say test.
Well, I use my I call it the blue box. I have the original analog machine that we use. They're these big blue boxes. They're analogs. All of us that still them, if you don't make them anymore, so you have to look for them on the internet. But all of us who are aficionados of microcurrent, we love using this particular piece of equipment. And there's 2 channels, and then you just simply select the frequency for the condition on channel A and whatever the target tissue is on channel B. And so we select those frequencies. We'll use our graphite gloves. We'll use sticky pads. We can use alligator clips with wet towels, any way to get the current into the body. And we will put these frequencies on, and you can feel tissue change. And things will soften everywhere, and people go, ooh, that really feels good. And the patient, we usually know that that particular frequency is working for them as well. So that is how we test frequencies. Now, Dennis, after doing this for 15 years, I can honestly tell you that when someone walks through the door, there is a certain way they look, a certain way they walk, certain things that they tell me, and it's like, oh my gosh, I know what this is. And Dennis, I know you've had that experience. Anyone that is an experienced practitioner that has seen a particular condition 1,000 times, when it walks through the door, as I like to say, it has particular energy signatures, and I just know what it is. So I will go ahead and just immediately go through those frequencies and see if it works. And probably 80% of the time I'm right. And then the other 20% of the time I have to go, it didn't get that right. And then start asking more questions and get more in depth and go back in time, and then we get other information that probably started the condition very, very early in life or at some other point, some other event. And then we can simply select those frequencies. And sometimes it's an infection, sometimes it's an emotional trauma, sometimes you find out that somebody had lead poisoning, mercury poisoning. In your neck of the woods, you're probably going to find out that people have a lot of thyroid disorder, and you have to go back and treat the thyroid. There's all kinds of other physical medicines that we might have to correct first in order to get other frequencies to work. So that's where you really want to have the experts and really know that there's frequencies for it and actually be able to go through that differential diagnosis. And of course, Dennis, you were the first person who taught me about differential diagnosis, for which I thank you, because my brain was set up with all of these filing cabinets for actually thinking through every system of the body and ergonomics, and activities of daily living, and all of the things that can happen to people. So fortunately, I came into this with all of those places in my brain set up to ask those questions. And it's made my job as a practitioner much easier. and I figure things out more quickly because of it.
I know, an illustrious career did develop from it. It's so nice to literally have given you your shove off to the pier, but boy, you've driven the boat ever since. You've done a fine job, Shannon.
Thank you.
I mentioned, because before we were on the air, I think it's really appropriate to have our listeners go through. I said, Shannon, I want you to talk about the devices today, and you said there are two. I think that it's worth the effort to spell out the brand of devices that you know. If there are three, tell them what the three are, so that there's no confusion here. I'd really want you to do that, Shannon.
Okay, well, the two that I use, and so I guess I'm just going to preface that and say that there may be a couple other things out there that I don't know about. There's an Accutron as well, now that I think about it, and some other devices. I'm not as experienced with anything except the two that were specifically came into being specifically for being able to run dual channel specific frequencies and using the frequencies that we have access to. And so the first one is the Inspiristar. That was the first automated unit to come out, and the engineer for that unit is Ming Wu, and he is in Arizona. And the units that came out after that are distributed through Precision Distributing, and those are made on the West Coast. So there's a programmable unit called a Custom Care, and then the Inspiristar is also a programmable unit. And hopefully we're going to have some new equipment that's going to be coming down the pike that we're going to have more versatility with and getting into the 21st century. So I'm hoping to see some people who will be doing that as well. So those are the two primary programmable units. Dennis, the one that I started my practice on when I was actually learning about microcurrent was a home care, and that is also from Precision Distributing. It's pre-programmed, and it's a physical medicine unit, so it has a lot of frequencies, combinations and programs already on it that would help most pain patients to a certain degree, but it has its limits because it's not customized for the individual. The Inspiristar and the Custom Cares are programmable. And so those are your biggie, and then the primary ones that are out there, you've got to have a practitioner that's well-trained, that is actually basically efficient, has an area of expertise in whatever your particular problem is, so that they can program those units for you, and they're managing you. And then for practitioners, they know about the professional units that we use that actually we would use in a clinical setting. There's a more expensive one that most practitioners use that's pre-programmed, but it has some ability to hold on frequencies and do other specific things, and that's called an auto care. So, but for most people at home, they're going to want to have a unit that somebody has programmed specifically for their needs, and as their needs change, they can reprogram it for them, or get a simple unit that is already pre-programmed, which is primarily for pain conditions. The challenge is someone has to teach you how to use it. So if you go and get something off the internet, it's not going to be as effective for you unless you have someone in a clinic that knows how to use it and show you how to properly use the unit. And also, microcurrent devices are FDA-approved medical devices, and they do right now require a prescription. So for a practitioner to dispense one, they have to be able to prescribe it. So you're going to need a MD, chiropractor, an acupuncture physician, or another practitioner, a dentist, someone that's in the scope of their practice, to write the prescription for it, and then you have to have someone train you on it. So you really shouldn't just go buy these things off the internet. Someone actually has to show you how to use them correctly and be a supervising practitioner.
Well, I know you feel very strongly about the education of practitioners. In fact, I can tell all of you listeners out there, especially those who are in the realm of medicine, working with patients, that we will be training practitioners in the Western Pennsylvania area. You feel so strongly about it, you're going to be doing the training. Isn't that right, Shannon?
Yes. I am so looking forward to coming up there, Dennis, and I'll I'll just jump right now and suggest to you that we should probably have an evening where we can do a 2 or 3 hour lecture and invite all of your listeners and any patients or other people that want to come listen and actually see the devices and have a demonstration, and we can talk about all things health that promote a better way of living, a healthier lifestyle, and wellness for people so they can be active and enjoy their lives. And I'm passionate about educating people, patients, clients, and I'm passionate about educating practitioners so that they can be effective deliverers of these type state-of-the-art therapies to patients.
Excellent. Right at that crescendo moment. I'll be telling our listeners in the very near future when to anticipate that. By the way, listeners, this is going to be sooner rather than later. Aren't we right about that, Shannon?
Yes.
Okay. Look, Shannon, we're at the gong moment now. I want to thank you so much. I thought the show today was a great one, a great theme. We'll be back together again next month. We haven't set the date yet. And then practitioners, listen for the announcement here, because when Shannon comes to town, and she'll be coming soon, we'll be able to inform you on how to get out there and become involved yourself. So until then, this is Dr. Dennis Courtney with Shannon Goosen saying so long for AM Impact on Your Health.
Thank you, Dennis.
Thank you.